Yes, welcome, Sheikh Omar. And actually, as you join, if you could just tell us where you're coming in from, it would be appreciated. Just tell us your name and where you're coming from. That would give us a perspective of how far people have traveled to be here. So to say, the virtual travel is important, is our time. So let us know where you're coming from, your name and where you're coming from. We'll start in 2 minutes. So welcome again. Yep. I see Esther, there's Check, there is Caroline Baker, Motlepula, Alois. Good. We have people from South Sudan, Cameroon, UK, Italy. We have people from Kenya, from Nairobi and the counties. We have people from Tanzania, Burkina Faso, Uganda. This is fantastic. So really, really glad. Yes. Wow, this is really good. Thank you, everyone, for joining us. And I think now, with the permission of my partner in crime, I'll start. Edwin, can I go ahead now? I think we have a good and solid. Twende kazi, asante sana. So to all of you, or more than 200 of you, we have a large number of people registered. So I'm sure they'll be joining us. My name is Dr. Gedenji Getahi. I am your co-host with my partner in crime, Edwin Masharia. We've hosted this since 2020, the Africa Dialogues. And I was saying earlier that my photo in the poster looks younger than I am now. That's 3 years after. So I'm a little older than when we started this. And as we do this very transformational webinar on climate change and health, I want to actually thank Edwin for having been part of the founding of this work and having managed to come along with me on this, and the role that Dalberg has played to grow the Africa Dialogue to where it is, and to all the partners and speakers who've been on this platform, and those who are with us on this platform today. And to all of you who followed this, joined regularly, some of you are new, others have joined previous dialogues. Thank you to everyone, wherever you are, and thanks to those waking up early, thanks to those sacrificing your lunch, and those sacrificing your dinner to join us today. So I want to make a very quick remark, and then I invite Edwin to also help in framing this conversation. As you can see, and as you'll see, we have a fantastic panel of speakers here regarding this crisis of climate change and health. So we just need to reflect on several things as we get into the conversation. We have record global greenhouse gas emissions now. We know that. We have seen records that actually we have, on average, the highest temperatures for a very long time since we started tracking in the 1940s. And of course, we know that life is being put at risk through these unacceptable greenhouse emissions and also the unacceptable warming that is coming as a result. We know that we want to limit the warming to a maximum of 1.5 degrees above pre-industrial time. We know that that may be possible if you look at laws of chemistry and physics, but not according to the laws of human behavior. The laws of human behavior are unpredictable. That is why we make commitments. And unlike chemistry and physics, where every principle gives you the same result, we are not getting the same result from our commitments. And I know we'll be hearing a little more from the organizers of and the people who've been working on this for a long time. So behavior, greed, markets, geopolitics are not a perfect science. The Intergovernmental Panel on Climate Change says that it is going to require rapid, far-reaching, transformative changes in the way we use land, in the way we use energy, in the way we use industry. We are developing our industry, building, how we plan our cities, transport, for us to actually make any change. The Economist, in a recent edition, said, forget 1.5 degrees centigrade, forget 1.5. So basically, we're saying that, number one, that is unlikely that we will manage to limit 1.5 to 1.5 degrees because of the continued emissions and also the non-commitment on the commitments that we have made, but also that we are seeing that it's not just about the 1.5. It's not actually just the 1.5. It's also continued increasing warming. So the impact of this failure for us to meet 1.5, but also the continued warming, is that it's going to be reflected in human health and human lives. So health is truly going to be the human face of the climate crisis. So we need to keep that in mind. Unfortunately, despite the fact that Africa is not emitting as much as the rest of the world, there'll be no discount for the continent of Africa. There'll be no discount when it comes to the impact. And in fact, there is studies that say that most of even the warming will be worse around the equator, 15 degrees north, 15 degrees south. And therefore, Africa, sub-Saharan Africa specifically, is going to be disproportionately affected by this warming. And we know, of course, that this is going to increase the impact on drought, heat waves, communicable diseases, outbreaks, non-communicable diseases as well, health system disruption, and the list goes on. A few numbers: 250,000 people are expected to die, extra deaths are expected between 2030 and 2050. A huge impact on cost, extra cost on health, $2 to $4 billion a year, extra direct costs to health. 50 years of progress are likely to be reversed as far as poverty reduction is concerned, and also risk in health. We are seeing that 68% of the climate-related health emergencies are to do with vector-borne and waterborne diseases, and this is going to continue. The question is, what is going to be the impact on communities, and what is the role of communities in reversing that impact? Climate change, the climate crisis, is not only going to be a singular crisis, it's going to be a multiplier of existing vulnerabilities, suboptimal health investment, gender inequality that already exists, discrimination of certain groups of people, youth being left behind. The climate crisis is just going to exacerbate this, including exacerbate the debt crisis, malnutrition, conflict, and threatening the universal health coverage dream. So today we are here to see what is the role of communities and young people in this response. So this is the framing of this. But I know Edwin has more to say. So over to you, Edwin, and maybe from there, you can introduce the panelists and we move straight into the conversation. Welcome all, and over, I'll give you now, Edwin.
Fantastic. Thanks a lot, Dr. G. It is good to see that even as you no longer have hair, mine continues to grow. So it shows that time and progress, they work in divergent ways. Great to be here again for the African Dialogues, version 2, where we are very focused on this issue of climate change and health. We have an incredible panel who will begin to tackle some of these questions. As usual, as you all know, there's an active Q&A section that you can use to pose questions directly to either moderators, and we'll put them to the panels, or to panelists directly. So please make use of that. Of course, make use of the chat for conversations between the community, because that is important for us to understand what are the things that are most important to you. For those who are non-English speakers, there's a translation interpretation facility that's available. So there's one of the buttons at the bottom should allow you to listen in French to this. As Dr. Gedenji said, this is a question that is substantial, and its impact will be massive in the quality of lives that we all lead. Yet there hasn't been as robust a discussion to date on the issue of health. And most of it tends to be from an economic perspective or energy aspect perspective. But at the end of the day, what does this mean for people's lives and livelihoods? As Dr. Gedenji said, we are seeing records being broken every single day. It is the warmest year we've ever had. We're seeing the dramatic booms and busts around dramatic droughts, dramatic floods, which then has an implication, especially on the African continent, on things like agriculture. And so, Kenya, for example, has had a fairly bad drought of the last 4 years. What does that mean for the stresses that Kenyans are feeling themselves from being able to feed themselves? We know that this will impact health. It's going to change the dynamics about diseases and disease patterns, right? What happens with the vectors and malaria and yellow fever? What happens with waterborne diseases? Do those become more prevalent or less prevalent? What happens with non-communicable diseases? In a previous webinar where we talked about climate change and agriculture, one of the really interesting things that was shared is if you look at the crops that would grow in a much warmer world, they have less nutritious value. right? So even the same amount of maize or rice or vegetables you had will not be able to give you the same nutritions. What does that mean for malnutrition on the African continent? What does it mean for supply chain of products that we use in the health sector, right? So there's multiple facets to this particular challenge. And all we are trying to do in these conversations, begin peeling back the onion and say, what do we as individuals, what can we do? What do we as leaders in our communities, what can we do? What do we, in the formal roles we hold in our organizations, as advocates, as heads of institutions, how can we make sure that this question is front and center and the actions being taken are the ones that make sense for the African continent? So to lead us into this conversation, we have a fantastic panel, and I'll introduce, actually, less introduction, I'll invite Dr. Omnia, who was the youth president for COP27, which was hosted, as most of you know, by Egypt, and played an incredible role both in framing those conversations that I had, and just as importantly, bringing in the voice of young people, who are the people who will feel this impact the most when Dr. Gedenji and us and others are no longer on this world. So Dr. Omnia, please share with, to help ground the discussion, please share what was the work that went into COP27, what your role was, and just as importantly, how do we begin thinking leading up to COP28 in December in the UAE?
Yes, first of all, thank you so much for having me in this very important discussion. And as the COP27 presidency, we always said that this is the African COP, because it was the first time in 7 years that COP was held in Africa. But at the same time, we wanted to also center the voices of the ones who are most affected, which are the young people. We have a fundamental right to be actively and meaningfully engaged in all the matters that affect our lives, but also our health. And today's young people account for 24% of the world's population. 200 million of them are in Africa. And we are disproportionately affected, not just by climate change, but by human activities which are leading to such unprecedented impacts on our physical and mental health, on our access to food, to safe drinking water, which is now leading to more disease and fragilities, particularly in our region in Africa. We're also seeing emerging infectious diseases that are now more common, more severe due to the increasing temperature. And also, most importantly, our mental health and well-being is being affected because of the unpredictable climate that is destroying our lives and livelihoods. And at the same time, we are facing insufficient climate action and political commitment to the health of us as humans and also the health of the planet which sustains us. And this really called for an urgent need that we recognized as the presidency to change the power structures that prevent particularly local communities and young people from being considered as experts of their own needs and their own priorities. And this also called for a shift in moving beyond being seen as young people as only beneficiaries, but to be engaging as equal and natural stakeholders to the climate decision-making process, which is so critical to developing inclusive, intentional, and mutually respectful partnerships between young people who are the agents of change and the key policy actors in the climate space. And only through this, we saw how trust and youth agency can be fostered. But concretely, we did that by first appointing for the first time a youth envoy, which is a position I'm honored to have, which is a youth representative within the presidency team that facilitates the negotiation process between countries in this very important intergovernmental process. We also did for the first time a youth-led climate forum where we had intergenerational dialogues and roundtable discussions between the ministers, the negotiators, and the young experts in adaptation, mitigation, and loss and damage. We also had the first ever dedicated session for African young people on the Youth Day to enable the youth coalitions within Africa to deliver their demands, their policy asks, as well as their needs and their challenges directly to the ministers and the policy actors at COP. And finally, we also had all of these different firsts and milestones recognized in the COP outcome decision, which is the Sharm el-Sheikh implementation plan that was adopted by over 190 countries at the end of COP. And it had the very first mentions of the recognition of the role of young people in the informal negotiation process, but also recognizing the importance of appointing a youth representative, as well as organizing these meaningful dialogues between the policy actors and the young people in this space. But really to look forward towards COP28, we're very proud to see that the UAE has also appointed a youth envoy with an amazing team that is working relentlessly to really build on and institutionalize the way that young people engage in the process, so that for every COP there is a young representative and a young team that really translate meaningfully the needs of young people. And we also have the first ever Health Day, which will also host a ministerial event that will invite ministers of health to come to COP for the first time to discuss and see how they can act on climate and health at the local and the national level. But it's also an opportunity to reflect that for the first time this year, the Intergovernmental Panel on Climate Change, the IPCC report, recognized health, mental health, as well as intergenerational injustice in its findings. And this is important for us to translate that into the global stocktake process, which is the first time ever that the Paris Agreement is going to be evaluated, and health as well as intergenerational equity must be part of this outcome, must inform the countries that are going to develop their new set of commitments and plans, and health must be a central component, not just the detrimental health impacts that we're seeing because of climate change, but also the health co-benefits and the opportunities of acting on mitigation and adaptation for the health of our people. And one last thing in terms of the next steps for COP28, we were very inspired to see that there was a survey that was done by 200 African young people that reflected on their needs of the region for COP and what they want to see. 64% saw that adaptation was a critical priority that needs to be addressed at the global level in every COP, but also at the national level. And 84% of the African youth in this survey saw that supporting funding for young people is essential for their needs and their concrete solutions to be translated. And this is very important as we are now shaping a narrative of emission reduction, of building ambition for adaptation, for climate finance. And we need to make sure that accessibility, especially for the grassroots young entrepreneurs, experts, and activists, is made available for them to really bring in young people as natural and as equal stakeholders to the climate agenda in Africa and globally.
Super useful grounding, and thank you for that. And we'll come back to the mental health side, because I know you are actively looking at that space at Imperial. So it'd be good to make sure that we ground that appropriately. Let me come to you, to Dr. Mamsala, because we talk about communities in not quite in isolation, but we talk about communities and we don't quite engage with them. Yet, your work at Primary Care International is exactly that, right? It's focused at the community level. Help ground the conversation on what are you seeing happening within the communities themselves, and just as importantly, what are the resources that exist within the community? So it's not just people who are waiting to be, to do nothing. They actually are actively engaged in figuring out some of these challenges for themselves.
Thank you, Edwin, and thank you, everybody. It's a real privilege to be here. I think I was invited as a representative of the community, and I suppose in a way I am a member of the community, but also to give a perspective from the health point of view. And it, and sometimes when you consider that, you often wonder whether I'm sort of the right person to do this, because they've got community health workers who are close to the community, who understand the micro changes that happen, particularly with respect to climate and health. So I'm going to give it my best shot to try and harness some of all of that learning that we've acquired along the way, and I suppose present it as articulately as possible so that we can see the way forward for the intersectionality between climate and health at that community level. And I think the first thing that I want to sort of highlight is we talk about climate resilience, but actually what we're referring to is community resilience in my mind, because often climate action at that community level is almost a corollary to health action. So if we are to address climate action at community level, we are by default addressing health action. We're thinking about the health promotion aspects of things as well as the health protective aspects of things. So making sure that we prevent being unwell when we're well, and even when we're unwell, making sure that we protect ourselves so that that our unwellness doesn't worsen. And that's all tied into the right environment, right? If we get the environment right and all of the factors that are part of that, then we're less likely to experience poor health. And a lot has been said already around what climate change brings, affecting our ability to have the right environment to grow the food that we need to eat, affecting our ability to have access to potable water, water management as a result of flooding and the diseases associated with that. We will see an emergence of a new type of disease as a result of climate change. And what will that mean for health systems and how community health workers deliver health? And then we talk also about safe and secure environments. I mean, we're going to talk a little bit about, hopefully a bit about mental health later, but we know that non-communicable diseases in particular rely on having a safe and secure environment where we can engage with an environment that allows us to be fit, exercise appropriately, not live a sedentary lifestyle, not live in an environment that makes us unwell. Our diet is really important. We've talked about the limitations that will come with changing environment as a result of, reductions in micronutrients within what we eat as a result of the changing weather. So the intersectionality is almost, I would say they're almost synonymous, right? Climate action and health. So when we then think about, well, what will be the step forward? It really resides in the community as far as I'm concerned. I mean, by the time somebody is unwell, by the time somebody gets to a health facility, we're often being reactive rather than being proactive. So we need to be much more proactive, certainly from the climate point of view, and indeed by default from the health point of view. And what does that mean in practice? Well, that means speaking to our communities, speaking to the community health workers who by default reside in communities, have a breadth of knowledge and a depth of knowledge that can influence the decision-making around how healthcare is delivered. So for example, I had the privilege to work with community health workers in the Caribbean region, and they have seen over time how their diet has changed, how their access to the right kind of foods have changed. They rely a lot more on refined foods. They've lost the skills of, growing food. That's mainly because there's been climate change, there's been soil change and all of that. So they've lost all of that. So they're sort of trying to, so in that particular community, they're trying to reverse some of those changes by firstly, developing a nutritional cookbook for the community to sort of learn how to eat healthier and better, which will have an impact on health. And then by extension, they're working on thinking about changing the policies at government level that ensures that people are enabled and empowered and possibly even remunerated and incentivized to learn how to manage their environment to produce a better quality food for themselves, but also in the context of climate change. So that's one specific example. Indigenous knowledge often is not harnessed, as far as I'm concerned, in terms of the conversation that happens at a macro level around climate change. What is it that people have done at a small micro level to respond to flooding? What have they done to respond to drought? What have they done that has been successful? Why are we not scaling some of these activities? And I think that has to do with setting the scene to ensure that happens. Often the academic and policy jargon that centers around climate action often does not resonate with people on the ground. And so there's something around how we can make climate action feel real for people and and they can also let us know how it influences them. So there is some level of discourse that needs to happen at community level. There's a role that people have to play that bridges that gap between the community and the governance level and how stakeholders come together. And then finally, I think just thinking about the ethical frameworks that can frame the action around, community health workers and what they do, because there's a community cohesion effect that will be lost as a result of climate action. There will be, networks that are disrupted, knowledge loss. So how can we ensure the stability and maintain that stability within the community and as by extension, the community health workers, so that the future relies with the community, and then that can then, I suppose, scale up to the macro level and the discussion around climate action and health.
Super, super, super useful. And actually the point you made is such a great segue to you, Raquel, on media and the role of media, right? And essentially being able to tell the stories, being able to unbundle these complex 500-page documents or 1,000-page documents and actually say, this is what it really means. And this is the action that needs to be taken. From your experience at Africa Uncensored, what have you seen in terms of the conversations that are happening around climate change and health, and what more could be done? And how can we all take advantage of the power of media to make sure that that action sits where it should?
Thank you so much. It's very interesting, and I'm very honored to be part of this conversation. But for the longest time possible, the media has been covering climate change and health as two separate entities, actually, where you find that climate reporting has been under the environmental beat, and where we do also have the health reporting also being under the health and wellness beat. So it's rarely that we get to see stories that look at climate change and health as one story. How can we interconnect these two and show the relation between these two? However, it has been changing over the last 1 or 2 years, where we're now seeing media being intentional in telling the stories, but there's still a very big gap that is there because we're not yet there. And to bridge this gap, we really need a lot of input, especially from community members, from health experts, from scientists, because one thing that I have from my engagement with other people is that they rarely understand how media works. More often than not, the stories that we get to cover, that we get to see on media, are stories that have been pitched by people. Someone from the community came and called a journalist and said, hey, I have this story that I believe this particular project that we're working on here in this particular location will be something that's very important. And that's very important because it gets to humanize a story, gets to help a journalist or the media move away from a data-centered, a data-oriented story and this big climate documents that are there, away from this global climate conversations that are there, but also localizing this particular stories just to show how other communities are relating to and also adapting to these issues. Because if we do not have that kind of collaboration and cooperation from communities, from those who are sitting at the grassroots level as climate activists, from the scientists and the health personnel who are also working and just showing us how, probably, for example, how these diseases are being affected by climate change, then we get to a position where media will relay what it seems to be as a dramatic story about climate change. And therefore, there will be no full representation of what should be about and what we should be driving at in regards to conversation about climate change and health. So these are some of the challenges that are there, but the beauty of it is that we're seeing a lot of journalists who are intentionally doing this, and a lot of even those in the medical sector and those in the climate field also coming together to just show media how best we can do this. But there's still a lot that we need to do because we are inadvertently driving a certain agenda and also slowing down a different agenda. But at this point, we are headed in the right direction, really. Yeah.
Sawa. Let me call on William, who you've spent a fair bit of time on exactly this question from a policy engagement perspective. I think you give the great example that even getting health ministers to understand the issue and engage on the issue has been a challenge. Why don't you share with the team again to ground the conversation on what the experience has been from COP27 and how you at Rockefeller are thinking about expanding the people who need to have this conversation as we go forward?
Thank you, Edwin, and thank you all the people and teams at AMREF for organizing and inviting me to speak here. So yeah, we at the Rockefeller Foundation have always been at that nexus of how do you use policy to drive some of the biggest challenges in the world, and how do you mobilize both government and community resources to overcome some of these challenges? And it's no different with the nexus between the climate emergency really and health. I think public health practitioners are way ahead in understanding the dangerous place that we are in today as a globe with the climate emergency and health. And this has been articulated very well by several speakers today. But our policymakers are unfortunately still not there. And this is through no fault of their own. I think policymakers have a huge myriad of problems to deal with. And so we find that there is a lag between what we know to be a serious emergency in climate and health and what policymakers are focusing on today, which is climate change and the environment. And this is what we have set out to do. And like you correctly said there in your opening remarks, we did try to convene together with our partners, AMREF. We tried to convene health ministers at COP27 in Sharm el-Sheikh. And it was very difficult to get any health ministers either to get approval from their governments to travel to Sharm el-Sheikh or for them to be convinced that they needed to be there, because they all saw it essentially as a climate change conference. We are working very hard to try and change this, because we're not going to shift any of these things. We're not going to get any of the kind of resources that are required on the ground and in government if we don't shift the policymakers and them to understand that this is the emergency that we require. So we've been doing a lot of work around this as the Rockefeller Foundation. We first convened all the actors who are funding public health today. We convened them at our headquarters in New York in April. Some of the people on this call were in attendance, and we got them to put their priorities on the table. And it was very clear that one of the things we had to do was to get policy makers on the agenda. And especially here in Africa, we needed to get health into the policy landscape around climate change. That was one of the things that was top of mind. And that's what we're working to do. And so we plan to use the Africa Climate Summit to host African health ministers and get them, first of all, to understand the nature of the emergency, and then to hopefully to develop a common position that we can show up with at COP28. We're very fortunate that the COP28 presidency, and very grateful to them, that they have set aside a health day. And so again, COP28 presidency has seen the need, learning, of course, from what happened in COP27 and the COP27 presidency, that health is a priority. And health, the discussion around health and the health emergency around climate is one thing, and it needs to be addressed jointly. I'll stop there, Edwin, and we can talk about what we need to do in order to move it forward.
Absolutely, absolutely. And Dr. G, as you're scanning the Q&A for additional questions, I'll ask Tamar to one quick question. So he also grounds for us that really important question of resources and financing, right? So, the World Bank is an easy one that people complain about, but actually there is action that's happening at the World Bank and the other multilateral institutions. Give us a sense of the conversations that you're having on and programs or efforts to unlock financing for climate change, but also the nexus between climate change and health, because we will need resources to exist. And then secondly, how do we make sure those resources don't just get stuck at the top, right? It's just, but actually gets to the grassroots, to the people who actually are feeling the impact and effects. So over to you, Tamar.
Thank you very much for this. First of all, I'm delighted to be taking part today in this panel discussion, and I think it's a very vital discussion that we need to have. And obviously, the financing piece of this is critical in all of this. I think I have four main messages that I'd like to perhaps drive across today. The first one really focuses on the cost of inaction. We've heard a lot about, the impacts of climate on health outcomes, the epidemiological, if you will, impacts, from climate exposures. But I think there's another element that needs to come into this discussion, which is important. The first one is really looking at the fact that nearly 132 million people would be pushed into extreme poverty by 2030 as a result of climate change. And that out of this 132 million people, we're actually seeing that nearly 44 million people under high impact scenarios would be pushed because of health-related impacts. Even if we take the more optimistic scenarios, you're still looking at 25 million people being pushed into extreme poverty. So there's a huge cost element, if you will. There's a huge economic element to the climate crisis. The second thing to mention that as we speak, it's costing governments up to 5% in GDP losses today. And this is based on results and analysis that we've been doing in the World Bank, really looking at the impact of the climate crisis through a health lens, considering 6 main health risks: malaria, diarrhea, dengue, diarrhea, stunting, heat-related morbidity and mortality, and floods, and really putting a dollar value on these morbidity and mortality costs. So again, that's a huge loss, if you will, in terms of the economic losses that countries can see. But at the same time, I think it's important to highlight that there are solutions out there and that we need to be able to ensure that we're scaling up those solutions, making sure that we're bringing resources at the national level for governments to be able to scale up on these solutions and to put in place the right investments to be able to do so. And I think that it's important perhaps here to mention that in looking at these solutions, one of the things that we're trying to do at a global level is really to think about potentially what would be the best buys for climate and health. Looking at this through a health systems lens, looking at it from an exposure perspective as well as health outcomes, and asking ourselves as we go through this 5 main questions in my view. The first one is in relation to those interventions, what would be the climate and health relevance of those interventions? Are these interventions that we are referring to really bringing in the health benefits intended, the climate-related health benefits? Are there any sizable, for example, mitigation benefits that can result from those interventions? The second question is really, are we targeting the right people? Are we reaching the vulnerable populations? Who's benefiting from us scaling up those interventions? The third one is really looking at the effectiveness and the impact of those interventions. How much are we actually getting those populations to benefit from this? Are we averting deaths and DALIs? Are we reducing carbon emissions as a result of that? And of course, from there to ask the question, what would be the return on investment, the cost effectiveness of those interventions, while still considering what potentially may be the significant risks in doing so. But in having said that, I think that we're already in the first step of developing the best buys for climate and health. And in fact, by COP28, we may be able to already announce one thematic area that relates to those best buys. Now, on focusing squarely on your question on how do we maximize financing for health and what is it we're doing in that respect. I think it's important, first of all, to answer the question, to maximizing financing to do what exactly? And in my mind, when we think about increasing financing for climate and health action, it really is to come in and focus on doing 3 main things. The first is addressing the direct health impacts of climate change. So this is one area that we have to obviously put resources in to be able to ensure that we're scaling up and able to impact on those health consequences that we're seeing from the climate crisis. The second one is strengthening the climate resilience and environmental sustainability of health systems and facilities. And the third one is really to come in to promote the health co-benefits of climate change mitigation in other sectors. To be able to do that, we have been already in discussions with a number of development banks, and I'm here not just referring to the multilateral development banks, but also the national development banks. We have the Rwanda National Development Bank, the Kenyan, as well as the Brazilian also involved in this, and a bigger group of development banks that are part of the Financing Common Coalition. And what we've been trying to do is define a co-investment framework that comes in really to focus on the kind of financing that is needed to bring in country plans in order to be able to conduct risk assessments at a country level, come up with country-tailored solutions, build the partnerships that are needed around those plans, but then at the same time also thinking about how do we increase capacity at a country level so that we have the right, obviously, set of expertise profiles, that we're able to develop national policy frameworks around climate and health. And from there, really to think about the hardcore investments that need to go into increasing resilience, adaptation, and mitigation at a health sector level. At the same time, we're very cognizant that, for us to be able to push on this agenda, we need to identify the sources of financing. And sources of financing are not just coming in from DFIs, but they start even with country budgets, with national budgets. So this is really about trying to understand how we can get governments themselves to focus also on the climate agenda, to have on-budget domestic spending on climate and health plans for capacity and interventions. But how can we also bring in catalytic funding and grants, through philanthropies that are more flexible, but can provide more risk-taking approaches, and it actually requires no form of return on it. And at the same time, how do we employ other forms of financing, including obviously concessional finance, and also from the private sector around impact investments, commercial investments, so on and so forth. Now, there was a question that was posted online in the Q&A section asking about, okay, well, do we then move into the pandemic fund track? My personal view on this, and I think that, this is also something that we've been discussing in the bank for quite some time now. This is not just about additional funding. This is not about a vertical climate and health fund. This is really about ensuring that we're integrating, if you will, climate into our health system strengthening agenda. How is it that we can move towards universal health coverage in a transformative way so that everything that we're doing in health system strengthening actually revolves around climate and includes both climate adaptation and mitigation into the design of country programs? So the first point I'd like to make here is that we need to rethink how existing funding is being used so that it's more climate informed and climate obviously friendly. But at the same time, we could also think about additionality in terms of bringing in new climate funding into this space, for example, through organizations like the Green Climate Fund, or we bring in new health funding for climate action. So the sources don't necessarily need to be about just the additional funds, but could also think about, the existing funds in the system. My final point on this is that once we've identified the sources, where the money is coming from, the level that we're interacting with, be it at national or at global level, the next question really is going to be what sort of instruments and modalities can we put in place? And there's a huge menu of different instruments and modalities that can be employed to be able to make use of those resources. We could be coming in with strategic matching grants, or we could be ambitious in creating green bonds, for example. We could be thinking about buy downs, loan guarantees, volume guarantees, outcome payments. So we need to be able to obviously, define these different instruments and modalities to ensure that we're making best use of the resources, be it existing or additional. Now, in this respect, what we have done is we at the World Bank is that we have convened a development banks working group to maximize financing for climate and health. And in fact, what we're currently in the process of doing is defining these sort of three areas that I spoke about in terms of what is being financed, what the sources of financing would look like, and the instruments and modalities that would be employed to make use of these resources. And hopefully by COP28, we aim to be able to announce some commitments on behalf of these development banks. Please make no mistake that the private sector is an important partner in this entire process, and the private sector obviously needs to be integral, if you will, within the financing space, as well as the delivery, if you will, of programs and interventions. So in that respect, I think that the role of the development banks, the national development banks, is huge. National development banks are by far the biggest players out there when it comes to financing development in general. Let alone, the focus on climate. In fact, we understand that in the last fiscal year, $27 trillion was the size of their active portfolio. Now, that's huge. So anyway, just to mention that, you know, the role of the national development banks is going to be extremely important. Making sure that we're making the links to the private sector is going to be equally important. My final point, and then I'm passing it back to you, is about ensuring that in doing this and in maximizing financing for climate and health, this is going to require partnerships at national, global, regional, as well as national level, ensuring that we have a harmonized approach of how we scale up, and ensuring that we're all coming in, speaking the same language, and obviously pushing ahead with the support to countries on the ground. Thank you. Over to you.
Fantastic. Great overview. Let me hand over to you, Dr. G, because you've been scanning the Q&A and the chat. And I know there's been lots of questions that have been there and useful debate. Let me hand over to you for that second phase of conversations with our panelists.
Wow, I wasn't ready for the Q&A. I wasn't ready. I wasn't trained. I wasn't taught. It has been, you know, quick and fast. I think we have so many questions. I'm trying to listen and summarize. And then there are also so many comments. So I ask the panelists, please look at the comment, the chat, look at the Q&A. The Q&A has almost 40 different questions. So I'll just highlight a few, but what a fantastic conversation. And I want to say that 529 people are in this conversation. That is significant from multiple countries. This is really significant. And before I ask the questions, I just want to highlight that this conversation is going to lead us into the conversation around health and climate change that are now being embedded into the Africa Climate Summit, Action Summit, which is going to be hosted by President Ruto. And as William said, we are going to be hosting ministers of health and ministers of environment and ministers of agriculture together to say, how do we bring all these sectors together? So there will be this conversation in Nairobi at the Africa Climate Summit, which is going to happen 4th to 6th. But after that is then how do we take that conversation forward to COP28 so that now the conversations enter the national determined contributions of countries and we now see action. We don't just talk. I have a few questions here, and those questions have to do with what are we going to do? So I'll just highlight a few. So first to Omnia, there are questions that, and I'll highlight all of them to the panelists and then we'll give them a chance to answer them. So Omnia, somebody asked whether you can share the survey that was talked about online, whether there's a link that people can see. So just hold on, I'll get back to you. So can you share that link? But also to comment on how are we engaging young people through, are there channels of listening to them? Are there channels of giving them rooms and tables in those rooms? And even the young people in the rural areas, you know, there's a mention here around there are 1.8 billion young and people and adolescents. I know that there is already a forum on that's being called the Global Forum on Adolescents coming up, organized by PMNCH. But how are we engaging these 1.8 billion people? And is there funding for them to actually mobilize grassroots action? So one, the survey. Two, how are we engaging them? And I want to see whether there is another question that came. So that's really the question for you, Omnia. But I want to also mention to the others as they prepare, as you speak. And again to you, Omnia, how is it that we can engage civil society activism in driving governments forward to do climate responsive budgeting? Now, for William, the issue is around how do we actually ensure that both domestic resources and external financing are working in tandem, which also relates to this question of governments locally being supported to do climate responsive budgeting. So how do we ensure that both external funding you talked about is working in tandem with domestic? And because Rockefeller is involved in the planning of the Africa Climate Action Summit, how do you see both domestic and external financing working together? And also, how do we make sure that this funding is also enabling grassroots organizations to boost community resilience? So those are the questions around for you, William. For Raquel, media in rural areas. We know that media is concentrated in urban areas. So all the things they're talking about, how, you know, we have media, we have social media, we have, of course, newspapers that have low penetration, we have TV, but how do you see media in rural areas? For Tamar, I think the question around, again, climate responsive budgeting and how you are the World Bank and others are enabling this climate resilience budgeting. For Mamsala, the question that comes to right to the top is, are we listening to communities? And what are communities saying? Are we listening to communities? So maybe to start with Omnia, then we go to William, then I'll go over to Tama, and then I'll end with Mamsala. So in that order, if you forget your order, I'll remind you. Omnia?
Yeah, first of all, thank you for the many questions. I took note of all of them. For the survey, I will share it now. And I'm very happy that you asked about the survey, because this survey was done during the regional conference of youth that was for all the African youth that took place before COP27. And this year, as you mentioned, there's the African Climate Ambition Summit. And before that, there's also the regional conference for youth that is specifically targeting all the young people in the region. And then we are working as well on another summit that is, so the findings from the regional or the ARCOI are going to be translated to the African Youth Climate Assembly, which is going to take place also in Nairobi from the 1st to the 3rd of September. That is going to be a way of preparing the young delegates to understand, but also to feed in their demands, their solutions, insights, and expertise that will then be translated into the African Ambition Summit. And then we also have the Africa Climate Week, which is also happening right after. And this is an amazing opportunity to really bring in civil society organizations, policy actors and ministers, as well as the young experts together. And we're planning a series of events during Africa Climate Week. There's going to be an intergenerational dialogue similar to what we did in Egypt that is going to happen in Nairobi. There's also going to be another set of sessions organized by Youth for Climate, which was the UK-Italy Partnership Initiative. And this year, they're not just focusing on policy dialogues, they are focusing on solutions and bringing in funding for grassroots solutions that are led by young people. And they're going to dedicate a series of sessions during Africa Climate Week for African youth to showcase their solutions and their initiatives, but also learn how to get that seed funding to scale and elevate their work in the region. I will also post the links to all of that. And this is primarily organized by the official youth constituency to the UNFCCC, or the UN Framework for Climate Change, which is YONGO. So I really, encourage everyone and every young person to be part of this constituency, which is open, and then to really get the African youth voices represented and their solutions integrated into the global advocacy that is being done for COP. To answer your second question around the engagement of local communities and civil society, and really making sure that our countries are not backtracking on their promises, I think it's important to recognize that it is not about COP. It's always about what happens after COP and before. So really meeting in with your delegations in your own country and formulating their policy asks that they go to COP and negotiate for is very important. Making sure that the voices of the communities that are offline, that are the most affected and yet they are least represented, making sure that their demands are translated to the delegations that are going to these events. I know AMREF is doing incredible work around that, around translating these grassroots voices to spaces like COP, but also COP is an opportunity to see what countries are committing to and then hold them accountable when they go back on the implementation, on the monitoring and the evaluation of these commitments that they signed on to, especially with the global stocktake and the implementation and the evaluation of the national climate commitments. One final thing from me, because we also mentioned mental health, and this is something that I'm also working on, but not at the global level, but also at the regional level. Our initiative is a Wellcome-funded project that looks at bringing in mental health professionals and the health community together with the climate experts, as well as the policy actors, in a series of dialogues to understand and to create for the first time a research and action agenda for climate change and mental health, to respond to the mental health needs of climate change, but also to look at the mental health co-benefits to climate action. So to both integrate mental health and climate planning, and then integrate climate planning into mental health and psychosocial support. We're going to do 2 regional dialogues in Africa. We're also building a community. So I would love to invite you to join us, to join the region, but also to join this global movement to really place health, particularly mental health, as a visible and clear priority for climate action.
Excellent. And I can see people just requesting, please share all the links, please share, drop the links. And for any other panelists who have a resource link, please share it. And what we are going to do in the summary of the note that we'll share with the attendee, we should include all these links so that people can actually refer to them. There's a lot of demand for that information. Now, William, over to you.
Thank you, Dr. G, and thank you very much. Wow, 530 people. I feel like a rock star. I mean, thank you. I think these are important questions. And, you know, actually, Dr. Tamer did partly respond to these questions, and he made some excellent points. And with his permission, I will write on them in answering these 2 questions about how can domestic resources and international resources work together, and what should governments be doing at the local level. Dr. Tamer's point was, look, we can't be talking about creating a new fund, all right, specifically for health. But the question is, how do we integrate the issue of climate change and health into existing mechanisms so that this issue can benefit from the systems that are already being set in place to mobilize resources? And the best way to do that is to ensure that climate and health gets onto the policy agenda for African policymakers. It gets into their radar. They begin to think about it as a climate emergency, as a health emergency. Then you can integrate it into those discussions. There are a lot of resources today being mobilized for funding nationally determined contributions, for mitigation, adaptation. That's where we need to get this health debate into there, and then we can take advantage of the international resources. And then, of course, domestic resources remain as important. It starts with government budgeting, and government can only make the appropriate budgets if they understand what they're paying for. Another excellent point Dr. Tamer made. Where is the money to be spent? All right. We are trying to get universal health coverage. We should. But what the pandemic showed us, coming out of now the emergency phase of the COVID-19 pandemic, it showed us that what we really do need, and climate change and health will require this more than ever, is an effective surveillance system. You need real-time data to make effective decisions. Uganda showed us they fought Ebola in under 90 days. How did they do that? How was such a remarkable result achieved in such a short time? Whilst they were still fighting COVID, they were still fighting malaria, still fighting HIV, and they were able to contain this very serious health emergency. It was by very, very robust contact tracing. And this contact tracing provided the data. They could have local lockdowns. They didn't have to do national lockdowns. They were very, very robust in there. And it was based on 100% community health workers, which then brings me to the second point. What can governments do nationally? Look, if we're going to collect data, there are many ways to collect data. But I think we are barely scratching the surface with community health workers. Community health workers live, many of them are from the community. But today, we don't have a standardized community health worker. Some of them are called community health volunteers. Some of them have zero training at all. They've learned from experience. Many of them are very brave, courageous, doing very great work. We need to have a professional cadre of community health worker that is ingrained into the public service, that has got a career path, that can show up, collect the data that is required in order for policymakers to make decisions. So we're not waiting for a horde of people to show up at public health centers before we know that there is a challenge. So that is something that government should think about. This is where they want to spend their money. And the most effective way is to look at how we empower community health workers, professionalize that cadre, and use them as this surveillance, early warning, and effective response system. Thank you.
Fantastic. Thank you very, very much. Community health workers, data and collecting it quick and fast, and where the money is spent, and not a new fund. I think we need a lot of layering on each other. We have global fund, we have Gavi, we have local domestic money, we have World Bank. They need to work together. So I can't even remember who I said would go next, but I will now go to Raquel.
I think Raquel is next.
Yes, Raquel. Good guess.
Yeah. Thank you so much. So the question was about media in rural areas, and the beauty is that we live at a time where media has been diversified so much, and the fact that we are always in the rush of finding which is the scoop or the newest story that's coming out now. You do have a lot of media organizations having sent correspondents or having reporters based in different parts of the country or of that entire location. And apart from just even the media houses that are based within the city in that country, you do have community-based organizations, community radio stations that, or even community radio magazines that are having all this, that are writing stories based or within that certain locality. And it's very interesting because it reminds me of how we always have doctors on call or even police officers on call. And I believe it's the same way that we should also do moving forward. Let's also have a journalist on call. Is there a journalist that you can always share your story with, where that if something happens and you're working on a certain project, that you're always looking at, wow, I think this will be a very beautiful story or a beautiful conversation to have. If the media gets a grasp of this, then you pitch your story or even call the journalist and say, hey, this is what we are doing. This is what we're working on. It's something that we have to do. Another thing is the fact that we rarely get to document what we are working on, even as community-based organizations. We just begin a project or work on a certain solution. And when we have problems, really don't even document what is happening. Because at this point in time where social media is something so big, you can get information by just the touch of a button, then that gives you the opportunity to also be a citizen journalist. And you can do this by sharing whatever that you're doing and looking and sharing information based on what is happening within your certain location. Because in one way or another, there's a journalist or a media house that will get hold of that information and will always reach out. So it's very important that we get to document our stories, even work with those journalists that are based there within your area, because as much as it may seem that it's a very small population, they might have a reach of probably 1,000 people based in that area. One thing to remember is that media is a very small village. It's one journalist knows the other, and it's always you always know each other. In one way or another, that information will reach out. But by community-based organizations and community workers and those within those areas documenting their stories, then it puts the media at a position where they can tell the stories more in a better way, and also just help to amplify these conversations to propel change and create the kind of impact that is required. Yeah.
Thank you. Citizen journalism and using channels that reach the people. And I see, many of the channels now are deep rural. As long as somebody has a smartphone or has a radio, they'll reach that. So we need to enhance those mechanisms. Let me come to Dr. Tamal now. Of course, the World Bank, IMF, and all these structures are involved in building capacity of governments to budget, public financial management. How do you use your mechanisms to encourage climate responsive budgeting into the future for African countries?
Yeah, thank you so much for the question, and big also shout out to my colleague Mr. Asiko for the elaboration on some of the points that I made in my earlier intervention. I think that definitely ensuring that climate is integrated into national budgets is an important step, but the starting point that, in my view, has to be around what Mr. Asiko was speaking to, which is actually understanding the country context. Before we even talk about budgets, I think this is really understanding what is happening on the ground. How do we see the adaptive capacity of health systems at a country level, national as well as subnational, i.e. really providing that sort of intel, if you will, on the kind of action that is necessary to be integrated within national plans, within NDCs, within LTSs, but also in the development of national adaptation plans. So to me, this is the starting point. From there, what we have been doing in the World Bank is we've been developing what's known as country climate and development reports. And this is an all-sector effort that really comes in to assess the links between the climate crisis as well as the impacts at a sectoral level, including obviously health. And then through that, having a dialogue with government or opening up, if you will, a platform before even talking about budgets and the size of the budgets that are needed, but just having, again, dialogue with governments, ensuring that this is country owned on what needs to be integrated within national programs to be able to ensure that climate, yet again, and I'm repeating this, is woven within the health system strengthening agenda. It's not about coming in and having a specific climate and health program. Then from there, I think then there's the whole discussion around, well, how does then climate get featured within national budgets? And I think, as you've said, this has to do with public financial management. It's a much broader sort of support that is needed beyond the health sector. These are discussions that happen with ministries of finance, and obviously, they percolate through the system, including, going all the way down to ministries of health. But if we come to think about it one more time, and repeating this point, because I think this is going to be the most important point to take away from today's discussion on the financing bit. Again, this is not about seeing a separate budget line item that says climate finance, but this is about ensuring that the structure of the programs that we put in place include climate adaptation as well as mitigation into this. So I don't want us to lose sight of the mitigation agenda. And the mitigation agenda is not because we're trying to sort of pinpoint or to blame someone for their carbon emissions that bear the source of the problem, because I've heard that time and again that many countries are saying we're being impacted by the crisis that others have created. I think the mitigation agenda is really to hit on three things. One is to ensure that we're improving the quality of care through different forms of mitigation activities. For example, electrification of healthcare facilities, ensuring that with the energy access, if you will, at a healthcare facility level, that you're able to improve, the quality of care. Two, to reduce costs in service delivery. And three, which I believe is a co-benefit in this case, is to reduce carbon emissions as well. My last point on this would be to say that in putting in place a way of really integrating climate into national budgets is going to be very important that we have some monitoring mechanism and a tracking modality really to track climate finance, how much climate dollars are actually going into the system, and to do some form of climate and health accounting, if you will, in that respect. Thank you.
Fantastic. There were summarized about the climate. It's not a climate budget, it's a budget on mitigation and adaptation. In all the activities that we're doing, it's actually integrating it, not an extra budget item. And I'm happy that you're doing the country climate development report. So if you have any country where you have already done the climate development report and the government is happy to make it public, please load a link so that people can see how that looks like. Good. Let us conclude now with the community engagement. Are we listening to the communities, Mamsala, and how are we doing that? And then I'll hand over back to you, Edwin. So Mamsala, after Mamsala, Edwin, you can take it over.
Thanks, Dr. G. Thanks, everybody. I want to actually thank Mr. Siko for touching on the role of that community health workers can play in making sure that we have healthier populations. I think it's essential. I think the UHC agenda has highlighted that. I think definitely that there is a structure discussion that needs to happen around policy making that ensures that community health workers are actively remunerated and considered central to the success of any health system. So I think that's essential. I want to take the discussion a little further back when it comes to communities and talk specifically to the assumption, which has peppered some of the discussions on the message board around the idea that communities don't understand how climate action is impacting them or how to respond. And I think that already in itself creates a distinction between where the source of knowledge comes from. And I'm particularly passionate about the idea that the source of knowledge actually arises within the community. And community resilience is being enabled and empowered to innovate and iterate to a changing and responding to a changing environment. But unfortunately, the stage at which we're at, we're not hearing what those community voices are about. So I think some practical steps, particularly if we're going to be taking some of these conversations to the policy level, is what are the channels that communities have at the moment to share their perspectives around how they might approach climate action, which they wouldn't see as climate action. What they will see it as trying to have a successful life, a successful livelihood. That's what they will see it at. What it needs to be from the policy perspective is being able to unpack what that means, because people are doing that on a daily basis. So what are they doing that allows them to do that? And how can we then mirror that to the macro discussions around what is happening at that sort of policy level? And how can we then harness that and scale that up? And I think one of the things that we probably haven't spoken in detail about today is actually the gender lens when it comes to community resilience, for lots of reasons which we won't explore today. But the role that women play in community resilience cannot be overemphasized. They typically lead change in informal settings. They're the ones who have a lot of the indigenous knowledge that we're talking about already. And if we want to think about what this might look like in the future, or even from now, we need to harness those voices in a safe space, in a space that is trusting, so that whatever they say can be collated, can be acted upon. And I like what Raquel was saying about, channels for conversation and reporting. And I think there are the formal channels, which of course community health workers can do around data collection, essential. You can't bring about change unless there is data that you can measure against. So that we know for sure. But there's some informal sources of discussion and, citizen activism. How can we empower communities to be able to speak up about, the good things, but also the bad things as well, and how they've responded to that. So I think there's a whole host of activities that can happen, but there needs to be an intentionality about how the voices are amplified. Policymaking is not just about, systems change, but it's also about who influences that system change. Where do we get the knowledge that influences that system change? How do we emphasize a bottom-up approach to how things are done? Because I think that truly is the way forward. We've done it the other way for so long, but actually discourse needs to be flipped. We need to amplify the voices that actually know what is happening around them, how they can change it, and how we can then make that something that influences decisions that are made at policy level, at government level, at national level, because all of this adds up and feeds into that wider action at a macro level.
No, super useful. And, we've just peeled, I feel like we've only just done the first layer of the onion, because the point you made is incredibly powerful that we haven't touched is kind of the, how is this experienced, across gender? We talked at least about youth, but we haven't talked about from a gender perspective. And that is such an important point to cover. I think the second point, which you touched on, and let me emphasize also a bit, is the thing that communities actually have incredible knowledge of how to live, in great harmony with the environment, right? But unfortunately, the way that the world is structured today is the person who benefits from that knowledge will be the, and with all due respect to those who've done this before, it's going to be the scientist who comes from Harvard or Stanford or Yale, who spends 6 months with a community, understands it, gets some insight, and publishes, in Nature magazine or in some peer-reviewed mechanism. That's the person who benefits from the community knowledge, not necessarily the people who have been holding that knowledge for hundreds, if not thousands of years. And I think we need to find a way to shift that power and that power dynamic to recognize, how incredible that community knowledge is and utilize it as a strength versus as a weakness, as it's sometimes viewed. We are coming close to time, and because I'm not a doom and gloom guy, I do want to see if we can end this on a positive note. And so I'll ask all the panelists to reflect on what's a thing you have seen that has given you hope that we can actually do that this will actually be humanity will be able to figure its way out of this challenge that we are facing now, right? That people on the call can say, okay, this is something that's happening in Uganda. Here is something that's happening in Rwanda that says, actually, there is positive momentum in the right direction, that if only other people understood it, other people were able to take it up and replicate, then we can actually all find the solutions. I will leave it open to whoever wants to chime in first. I see, Omnia, you're off the mic, so I'll come to you first. But I do want to hear from every single panelist on what their reflection is, big or small.
Yes, I think what gives me a lot of hope is, seeing us as the health community bringing in the urgency of taking climate action, understanding how it is a people's emergency, but also it is an opportunity to build a better, a healthier world for my generation and the generations to come. But I see so much agency and so much around us supporting each other, building the resilience of our communities, translating the needs of the most affected and the most vulnerable into concrete action that is supported by the necessary funding, but also looking at how we can integrate these needs into action and really supporting one another while doing that. So I always feel very privileged and always inspired by being part of the broader climate and health mobilization movement and community.
Fantastic. Who wants to go next?
I will.
Excellent.
Yeah. So what gives me hope at this point is the fact that a lot of people are now coming in to engage in this conversation. It is not just left solely to those within who are having these conversations, or the climate negotiators, or even those in the health sector, but basically everyone. From a media perspective, it gives me hope because there's a lot of investment that's coming in to the media by organizations and that just want to support media work in that will get to tell stories about climate change, about health. And the kind of investment that is coming is not just finances to help journalists travel, but to also capacity, to create that capacity building where they get to train journalists and do all that. And that is very important because a few years ago, this wasn't really happening. A pitch in the newsroom about a story on climate change, if it wasn't really dramatic, if there were no loss of lives, if it didn't involve this image of a community suffering, it wouldn't have made a top story. But at this point, these are stories that are leading in our bulletins, at least, because of the kind of impact and the kind of effect that it has on all of us, even if we are not in these villages where there's the rising of lakes, there's the infectious diseases, where there's a lot of infectious diseases. But and so that is really amazing. And I really can't wait to see probably in the next 1 year how this goes, because it's really encouraging to see the list. Yeah.
Fantastic. I'm happy to cold call.
Yeah, it's fine. I'll go. Thanks, Edwin. I think for me, what's particularly exciting to see is actually the involvement of health at the Africa Climate Summit. I think the fact that ministers of health are proactively being invited to the table to have the conversation is unprecedented. And I think that will bring some significant change around the policymaking level, which we want to see trickle down to health system decision-making, capacity building, certainly from my perspective. And I think the other thing that also gives me hope is that there are small initiatives happening around the world all the time. And I think there's something around how, using technology to kind of bring those stories together through media, through whatever channels that they are, because there is a need, I think, to cross-learn, to learn from each other. Technology has allowed us, and I suppose COVID in a way, to have this kind of conversation of 500 and however many people across the world being able to share insights around climate change and health, which we would have never been able to do before. And I think that there is some harnessing that needs to happen around that so that we're all cross-fertilizing and learning from each other. But there's also some collaboration that I think needs to happen. There's a lot of work happening at community level around, say, for example, agriculture. CAMFED, for example, comes to mind. There's some stuff happening with community health workers in health. Where is the opportunity for collaboration between, all of these things could be happening in the same community. Can the same community come together and say, this is what we're doing for ourselves as a community, and we're not going to label it either as climate change or health. We're going to label it as looking after our future. So that's really what I'd like to see happen. And I can see that that's possible.
Fantastic. And for some strange reason, the gentlemen go last. I don't know why. You're not quick on the mic. Over to you, William.
Thank you. Thank you. We were actually letting the ladies go first. I'm sure that was the intention, Dr. Tamara. So look, what gives me hope is that, we have the solutions here in Africa. Look at this panel. We're all Africans. If you think about some of the leading public health institutions in the world, Africans are at the head. We have the answers here. We, have resource challenges. We have public financial management challenges. We have numerous challenges, but the answers are here. We have them. We need to tap into the resources that we have in order to do them. And we did. We did in Uganda with fighting Ebola. We did in many countries in Africa in fighting COVID-19. Where Africa it seemed to do much better than many other countries, which a lot of people didn't expect. All right, and we are now taking control of the agenda around the global financial architecture and what we need to do to be better at having these discussions at the table where decisions are being made about Africa. And we're saying no longer all we want is a fair system. All we want is to sit down, let us put our obligations on the table, but let's have a discussion as equals. I think these are really important shifts in the mindset of Africa and Africans, which does give me a lot of hope. I'll hand it over to Dr. Taba.
Thank you very much. So I'm going to start with saying that my biggest hope is that we're actually, for the first time, listening to the voice of the youth. I am so happy and proud to see Dr. Al-Amrani joining in all of these conversations at different levels, and that she's bringing that voice forward. And I think it's critical. The youth definitely are bringing in fresh ideas into this conversation, and I think the role that they play needs to be further augmented and amplified. So to me, that gives me a lot of hope that, we're moving in the right direction. We're bringing in the right stakeholders, and I'm proud of you, Omneya. The second point that gives me also a lot of hope is the voice of communities and the role of civil societies. I have been very honored to have been included on a number of sessions with AMREF and other civil society organizations around this discussion. And I think the more we engage through civil society, the better and more realistic we will be in terms of how we scale up action and how we ensure that we're actually connected with what's happening on the ground. So a big shout out definitely to AMREF, and thank you so much for challenging us and for keeping us accountable. I think between the voices of the youth and civil society and communities, that's a way of keeping us accountable at a global level in terms of what we do. My final point perhaps here that really, that I want to emphasize that really gives me a lot of hope is the fact that for the first time ever, COP is going to have a dedicated health day. That is unprecedented. It's a unique moment. It's a huge call for action. This is when we have to ensure that we're all working in unison and with concerted efforts really to push the not just the political agenda, but to ensure that there are clear commitments on behalf of the global community. And in this respect, I would like to say that this is not the time for institutional egos. This is a time for collective action. This is the time to break down institutional barriers. Mr. Asiko, as he was speaking, and as I was speaking, and the others that we've been listening to, we're extremely aligned. So at the end of the day, this is one team, one global team to fight a climate crisis together, and to be able to do so, the only way is by breaking down institutional boundaries. The only way is by ensuring that we have a harmonized, coordinated approach for action. And the only way is that we speak with one voice, be it a voice that comes from the youth, or a voice that comes from civil society, or a voice that comes from international development institutions or financial institutions like ours in the World Bank. So one voice, one crisis to deal with, and it's one world. Thank you.
No, fantastic wrap up. Appreciate all of you panelists for engaging so robustly, being quite open with where you see things are, and hopefully at the end also being hopeful that we are making progress on this. I know we at Dalberg, always, we are largely in the background, right? We are an advisory business. We prefer if our clients are front end, center end, and being seen. And this has been a fantastic collaboration with AMREF in putting together these dialogues and getting these conversations to happen, because they matter. And so I hope everybody, all the 500 people who've participated are coming and say, wow, I actually learned something new. I have a connection to be made. And there's a lot of those connections, websites, WhatsApp chat groups that are being created on the fly. Please take advantage of those and connect with other people, because it's only by holding hands and walking this journey together that we'll have the kind of impact that our continent needs. So super proud of all of you taking time. I've really enjoyed the discussion, really enjoyed seeing all the chat conversations. And I hope before we wrap up, anybody who has seen anything of interest, you will click on, join the WhatsApp group, find the link. It's all there. And of course, it will also be, a recording of this will also be shared within 24 hours. The final thing I'll say, and then I'll hand it over to you, Dr. G, is, as mentioned, there is this big meeting that's happening in Nairobi in September, right? Where the anchor piece is that Africa Climate Summit that is hosting by President Ruto. But as Omnia said, there is the first to the third, which is that youth conversation that's going to happen. So anybody who is in the audience who wants to be part of that, please join that. The formal discussions will run from the 4th to 6th. There'll be lots of conversations, lots of side events, lots of media around it. Please engage. Please help push the collective thinking forward. With that, I'll hand over to you, Dr. G, for the wrap up, and saying kwaheri to everybody.
What a fantastic conversation. I want to say that I want to thank Dalberg, Edwin and your team. They have been our thought partners and developers of this and co-anchors of this. And they are also, in the meeting that William talked about in terms of the financing landscape of climate change and health, they did a fantastic analysis of that. So please feel free to get to us if you want to follow up with this conversation. Desta, if you could put your contact for anybody who wants to follow up on a partnership for either during the climate change meeting that's happening, or even UNGA, or next year, or this year in September in New York, or even the COP28. Anyone who wants to kind of follow up on how we can partner with AMREF and Dalberg on this, please just drop an email to Desta and do so. But a fantastic conversation. Thank you to all. I think in conclusion is to say it's not possible to conclude this meeting. This meeting cannot be concluded because there are so many things that have been left on the table. Mental health, gender, equity. I saw someone post on vulnerable population, people living with disabilities, and what's their role in this. So we have so much. So we cannot conclude this meeting. So there cannot be concluding remarks. But a few takeaways to say. One, the resources are right here in Africa. You can see them on the screen. The resources are right here. We are not victims. We actually have the solutions. If only we can ensure that the knowledge our communities have and recognize that the communities have resilience in themselves. All we are doing is how do we harness that resilience that already exists. We are not going to pour it to them like delivering food or water. It is the resilience that they have that we are going to get to actually use to get out of this ourselves as the African people. And we must embed equity and in the center of it, leaving no one behind. Let's make sure that we use the health time provided in the Africa Climate Action Summit and also a COP28, not for health to engage health people, but to make health everyone's business, so that we bring in everyone in climate, in energy transition, in agriculture, food systems, in transport, in planning of cities, to realize that health has to be the center of the climate change policy. To all of you, more than 500 of you who joined us, thank you. And all the best to everyone. See you soon. Bye-bye.
Bye, everyone.
Asante Nisana. Take care, everybody.
Thank you. Bye-bye,
Thank you
everyone.
to all the panelists. Bye-bye.